Welcome to our channel. Today we're diving into Acute Respiratory Distress Syndrome, or ARDS. This is a serious condition that affects the lungs, making it difficult to breathe and get enough oxygen into the body. By understanding ARDS, we can recognize the signs and symptoms early on and seek prompt medical attention when needed. So what exactly is ARDS? ARDS stands for Acute Respiratory Distress Syndrome. It's a life-threatening lung injury that causes fluid to leak into the tiny air sacs in your lungs called alveoli. This condition can develop rapidly and often requires immediate medical attention. When fluid builds up in these air sacs, it prevents your lungs from filling with enough air, which means less oxygen can reach your bloodstream and vital organs. This can lead to severe breathing difficulties and a significant drop in blood oxygen levels. This lack of oxygen, known as hypoxemia, can be extremely dangerous and even fatal if not treated promptly. Patients with ARDS often require mechanical ventilation and intensive care to support their breathing and stabilize their condition. With early detection and appropriate medical care, the chances of recovery can be significantly improved. Treatment focuses on improving oxygen levels and addressing the underlying cause of ARDS, which can vary from infections to trauma. Now that we've covered the basics of ARDS, let's delve into the different types, direct and indirect ARDS. Direct ARDS occurs when the lungs are directly injured, like from pneumonia or inhaling harmful substances. Indirect ARDS happens when the injury originates outside of the lungs, like from the severe sepsis or major trauma, but eventually impacts the lungs. Understanding these types helps in identifying the root cause and guiding treatment. Let's dive deeper into the most common causes of ARDS. Direct causes include pneumonia, aspiration, and near drowning. Indirect causes are often systemic, like sepsis, severe pancreatitis, and major trauma. Sepsis is a life-threatening response to infection that can lead to widespread inflammation and organ damage. Pancreatitis triggers inflammatory responses affecting the lungs. Trauma from accidents can lead to shock and lung damage. While ARDS can affect anyone, certain factors significantly increase the likelihood of developing this serious condition. Understanding these risk factors can help in early identification and potentially in prevention. One significant risk factor is age. Older adults are generally at higher risk due to the natural decline in lung function and the presence of other health conditions. Pre-existing lung conditions like COPD or asthma also increase the risk. These conditions can compromise lung function, making it harder for the body to cope with additional stress. Lifestyle factors such as smoking and heavy alcohol use can weaken the lungs and immune system, making individuals more susceptible to severe respiratory conditions like ARDS. It's important to note that while these risk factors increase the likelihood, they don't guarantee ARDS. Each individual's health profile is unique, and other factors may also play a role. Many individuals with these risk factors never develop ARDS, while others without them may still develop the condition. Awareness and proactive healthcare can make a significant difference in outcomes. Diagnosing ARDS involves clinical evaluation and specific tests to assess lung function and identify the underlying cause. Early diagnosis is crucial for prompt treatment and better outcomes. Doctors typically begin with a thorough medical history and physical exam. A chest X-ray can reveal fluid buildup in the lungs, a hallmark of ARDS. Blood tests measure oxygen and carbon dioxide levels, helping to determine the severity of the condition. Blood cultures may also be performed to check for infections like sepsis. While not all cases of ARDS are preventable, there are steps you can take to reduce your risk. ARDS, or Acute Respiratory Distress Syndrome, can be a severe condition, but being proactive about your health can make a significant difference. If you smoke, quitting is the single most important thing you can do to protect your lung health. Smoking damages your lungs and makes you more susceptible to severe respiratory conditions, including ARDS. Preventing infections is crucial. Get vaccinated and practice good hygiene. Regular hand washing and using hand sanitizer can help keep harmful germs at bay. Ensure you're up to date on your pneumonia vaccine and get your annual flu shot. These vaccines are essential in preventing respiratory infections that can lead to ARDS. If you have a pre-existing lung condition, work closely with your doctor to manage it effectively. Regular checkups and open communication with your healthcare provider are key. This includes taking your medications as prescribed and avoiding triggers that worsen your symptoms. By following these steps, you can help protect your lungs and reduce your risk of developing ARDS. Early detection is absolutely key when it comes to ARDS. ARDS is a serious condition with potentially life-threatening consequences, and the sooner it's diagnosed and treated, the better the chances of recovery. If you or someone you know experiences severe shortness of breath, rapid breathing, or blue discoloration of the lips or fingertips, seek immediate medical attention. Time is of the essence when it comes to ARDS. Don't hesitate to seek medical help if you suspect something is wrong. Thank you for watching. If you found this video helpful, please like, share and subscribe to our channel for more informative content. Stay healthy and take care. We hope this video has empowered you with a comprehensive understanding of ARDS. Remember, knowledge is power, and by being aware of this condition, we can all promote better health outcomes. If you have any questions or concerns about ARDS or any other health topics, please reach out to a healthcare professional.